In this section, 8.2, we'll be talking about the bones and features of the human skull. We'll be talking about the difference between cranial and facial bones. We'll name all of the different bones of the skull and talk briefly about their anatomical features. We'll talk about some of the cavities that we find in the human skull, the principal sutures that join the different bones of the skull together, some of the bones that technically aren't part of the skull but are associated with the skull, and then we'll talk about how the skull changes from birth to adulthood. Arguably, the skull is the most complicated part of the skeleton. On its own, it has 22 bones that are held together by sutures. And when I say suture, what I'm talking about is a joint between two bones that is fused together in such a way that the joint no longer moves. We also have several cavities in the skull, and we'll talk about those. We have some foramina, or holes, that allow for nerves and blood vessels to pass through. We have different sinuses in the skull, and we'll talk about their function as well. So we're going to first start with talking about the cranial bones. So the cranial bones are the ones that house the brain. So the cranial bones are around this exterior and also through kind of the middle of the skull. They're separate from the facial bones. So the facial bones are over here. They don't directly protect the brain. Okay, so the cranial bones are right adjacent to the brain. So separating the bone from the brain is a series of membranes. Another term for these membranes is the meninges. The thickest, most important of those membranes is the dura mater. Okay, so the brain case can roughly be divided into three basins. Okay, so the most posterior, right here, the posterior cranial fossa, we can see it here also, that holds the cerebellum. Okay, so the cerebellum portion of the brain is going to fit right in there. It has this big opening called the foramen magnum, and that's where the spinal cord goes through. In the middle, we have the middle cranial fossa, and the temporal lobe fits into that fossa. And then, closest to the facial bones, we have the anterior cranial fossa right here, and that's where the frontal lobe fits into. So this portion of the skull is made up of 8 bones. We have 1 frontal bone, 2 parietal, 2 temporal, 1 occipital, 1 sphenoid, and 1 ethmoid. And we're going to talk about those bones one by one. Okay, so we're going to start from the front with the frontal bone. So the frontal bone is kind of in the salmon color that's right here. It makes up the forehead and the top of the head. Also, the top of the eye orbitals. Okay, and the frontal sinus is also part of it. The parietal bones are shown here in purple, and they are the largest section of the skull, of these cranial bones. Okay, so the frontal bone joins the parietal bones at a suture called the coronal suture. Okay, so that goes right across there. The 2 parietal bones are fused together at the sagittal suture. The parietal bones join up with the occipital bone, that's this green part here. They join up at the lambdoid suture. And then where the parietal bone comes together with the temporal bone, that happens at the squamous suture. Okay, so we have 4 sutures here that are important: coronal, sagittal, lambdoidal, and squamous with the temporal bone. So now we're talking about the temporal bone. The temporal bone is this purple one here. Okay, so the temporal bone has 4 parts. I'm not going to ask you about the 4 individual parts on the exam, but if you want to know for your own information, there's squamous, tympanic, mastoid, and petraeus. Okay, so this is kind of the ear area, and we have the what we call the external acoustic meatus. That's where the ear canal forms. And we can see the temporal bones from the internal view here. Okay, so the occipital bone is the back of your skull. Okay, so it's this green area here. We have the occipital bone. It contains the foramen magnum. That's very, very important. Look for a question like that on the exam. I think that's an important fact for you guys to know. We also have things called the occipital condyles, which are knobs on either side of the foramen magnum that kind of protect that junction between the skull and the beginning of the spinal column. Okay, next we're going to talk about the sphenoid bone. And the sphenoid bone is probably the trickiest one to visualize. We can't really see it from outside. I can't point to it, in my own head, because it's kind of in the middle. It's separating the cranial bones from the facial bones. So this is pretty deep inside your skull. It's behind your nose, it's behind your eyes. It's kind of in the middle of your interior of your skull. Okay, so we can see it here if we have the top of our head cut off and we're looking downward. We can see it here if we cut our skull in half. This is a very complex shaped bone, and it separates the brain case from the sinuses and facial bones. All right, now the ethmoid bone. The ethmoid bone is found between your eyes. It's kind of closer up to your forehead, and it forms the edges, the interior edges of your eye orbit. It's involved in the nasal cavity. It also has a role in humidifying air as you breathe, so it helps your nasal cavity be more comfortable and less able or more defended against pathogens. Having too dry of air coming into your nasal cavity can lead to cracks in that mucous membrane and allow pathogens to get in. So humidifying that air is a protective function. All right, so now we're going to look at the eye orbit. So this is your eye socket, and we talked about up here, we have the frontal bone. And we haven't talked about the maxilla yet, but that's coming up soon. That's going to be here. The zygomatic bone is on the outside, closer to the side of your head. And temporal bone is back and behind. We talked about the ethmoid bone. Okay, so these are the things that make up around your eye. Your nasal cavity is a very complex portion of your body. There are medical professionals who specialize just in the nasal cavity. There are a lot of bones here. They're irregularly shaped. They are performing some important but complex functions in allowing you to breathe and also protecting you against pathogens. Okay, so now we're going to move on and talk about the facial bones. So the facial bones are more on the front of your skull, associated with the facial features that you can see. They support your teeth. They give your face your individual unique appearance. They form your eye socket and your nasal cavities. And they are where muscles attach. And that's what gives you the ability to express emotions on your face and also chew. So the maxillae, there are two of them. So one is maxilla, two is maxillae. These are these bones right here, kind of the off-white color, and they form the part of your cheeks closest to your nose and your upper lip. What's below your cheeks and your upper lip is your maxilla. Also, your maxilla forms part of the roof of your mouth. We call that your hard palate. Okay, so that allows us to chew while we're breathing. That's kind of something unique to primates. And it also is the floor of the nasal cavity and all those complex structures that are there. The palatine bones are here. So here we've cut across the skull and we're looking from like the interior of the mouth up. Interior of the mouth down. So the palatine bones are here and they form another part of your hard palate. Zygomatic and lacrimal bones. Okay, so these ones are, your zygomatic bone is something that gives your face its unique appearance. Your zygomatic are your cheekbones. So if you have high cheekbones or prominent cheekbones, that is due to the shape of your zygomatic. And also forms the outside of your eye socket. The lacrimal bone is here in red, and it's an interior part of your eye socket, smallest bone in the skull. And then we have some other bones that are smaller than, for instance, the maxilla. We have the nasal bones. The nasal bones are here in purple. The nasal bones are often broken. If we ever get hit in the face with a baseball or are in a fight, the nasal bone is one that can break fairly easily. This is the bridge of our nose. The vomer is part of our septum between our nostrils. And then the inferior nasal conch is here in between. Okay, so it's part of that sinus complex there. All right, and we're going to finish up with the mandible. So the mandible is your lower jaw, supports your lower teeth. It's the strongest bone of the skull. It's the only one that we can consciously move. All the others are fused together and are, generally speaking, immobile. So muscles that attach to the mandible allow you to speak and also allow you to choose. The mandible is actually two bones that are fused together in early childhood, and that joint at the midline is called the mental symphysis. And also the mandible gives your face some shape. If you have a square jawline or a large chin, that's due to the shape of your mandible. So technically not part of your skull, but associated with your skull are two other things. We'll talk about the hyoid first. So the hyoid bone is between your chin and your larynx, your voice box. It is not connected to any other bone. Only bone in the body we have that is not connected to any other bone. It's suspended from the skull by what we call the styloid process and the stylohyoid muscle. And if somebody is strangled, a lot of time the hyoid bone will be damaged. We also have what we call the bones associated with the inner ear, the middle ear cavity. They are the malleus, the incus, and the stapes, and those are the 3 bones of the inner ear. So you guys have probably heard that newborn babies have a soft spot at the top of their head. And this is true. The bones of the cranium haven't fully fused together. So that is a place where an impact could cause a major injury to a newborn because those cranial bones haven't fused together. The cranial bones stay separate because during birth, the process of being forced through the birth canal could cause skull trauma if the bones don't have that flexibility. So as the newborn starts to grow and mature, first a fibrous membrane forms between those bones, and then the sutures become more and more fixed as the child grows. The frontal bones fuse by age 6, and generally speaking, the skull is as big as it's going to get by around age 8 or 9. Okay, so here's that soft spot. We can see right here, that soft spot at the top of a newborn's head that in an adult is fused together, and we don't even have any opening there at all. Here's the sagittal suture and the lambdoid suture, and those also ossify as the child gets older.